I'm Dr. SATYASEKHAR, consultant physician from Visakhapatnam.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
As you see, Imeglimin offers a novel approach to diabetes management by targeting particularly the mitochondrial functions, which is distinct from the mechanisms of the traditional anti-diabetic drugs which are available right now. Its ability to enhance insulin secretion and also insulin sensitivity, also ability to inhibit hepatic gluconeogenesis makes it a novel option, and also it supports the pancreatic beta cell function, and so it saves the beta cell mass also. So it's a valuable addition to the diabetic armamentarium we have right now, and it is also particularly useful in patients who have not achieved optimal diabetes control with whatever existing therapies are there.
In what specific patient populations do you see the greatest benefits of using Imeglimin?
So particularly when there is a patient is not having good control with existing therapy, we are using this right now. And also in those patients who have uncontrolled diabetes with multiple metabolic dysfunctions, we are using it particularly. And also in those people who are particularly not able to tolerate metformin, Imeglimin will be a good option in those patients.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? You can share a real world case if any.
In my clinical experience, either given individually or as an add-on therapy, it can help reduce the existing medications. Also in patients who are on insulin, we have been able to reduce the dose of insulin also. Just shown good improvement in the glycemic control without causing significant side effects, particularly GI side effects or hypoglycemia. Also proves to be effective in reducing the dose of other diabetic medications. It's mainly the dual action on insulin sensitivity and also the insulin secretion, and with its mitochondrial mechanism provides the effective glucose control, also protecting the beta cell mass and improving the beta cell function. So also it has the peripheral actions like the hepatic gluconeogenesis, also in increasing glucose uptake in muscles. It also helps to be having a synergistic effects with other anti-diabetic drugs because of this complementary mode of actions.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
Having a sustained release form of Imeglimin definitely improves the compliance of the patients, and also with the sustained release form, you can see that there are 50% lesser GI side effects, so makes it more tolerable and more complementary. Patients are becoming more compliant with this.
How does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
So the mitochondrial function is very crucial for cellular energy production and also metabolic regulation, as we all know. And the metabolic dysfunction is the most important underlying mechanism of insulin resistance and impaired glucose metabolism in diabetics. And this has not been targeted till now. And this, by targeting this mitochondrial dysfunction, Imeglimin has become the novel addition to diabetic armamentarium. It addresses the fundamental aspect of the diabetes and it helps to restore the normal metabolic process. It not only aids to lower the blood glucose levels, also to improve the metabolic health by targeting the metabolic dysfunction associated with diabetics.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
Yeah, two things mainly: the lesser GI side effects and lesser hypoglycemia, also better tolerability. These are the safety wise. And coming to the efficacy, it has shown that several studies have shown that favorable benefit of reduction in hyperglycemia with the addition of Imeglimin to existing treatments for diabetes. And also it is having, because of the mitochondrial benefits, it has a better edge over other drugs in preventing the metabolic complications like metabolic cardiomyopathy and diabetic neuropathy.
Do you believe that Imeglimin has the potential to change the future landscape of diabetic treatment?
Yes, significantly it can impact the future of diabetes treatment because of its novel mechanism of action, which complements the existing therapies without disturbing any of the other drugs. We can add on as an add-on therapy, And also in an initial treatment for initial newly diagnosed diabetics also we can use. And as a not just improving the glycemic control, it also helps in preventing certain complications like cardiomyopathy and neuropathy, particularly because of its beneficial mitochondrial effects. So because of its efficacy as well as safety and tolerability, and Imeglimin is can be seen as a future valuable option in diabetes treatment.